talk for a moment about ankle sprains because I really do see them. The most common a sprain is when a ligament tears. It can be mild, moderate, and severe. And we all know about the ankle twisting inwards and tearing the ligaments on the outside. And I just want to tell people that it's worthwhile not underestimating those sprains. Mm-hmm. You'll see many people who play and they tear the ligament and say, I can live with this, and the ligament heals, but it heals a little bit too long, so they have a little bit of looseness there, and they're more prone to sprain it over and over again. I really think it's worthwhile, in the case of a sprain, to see Dr. Gormon or to see me, because with proper treatment, you can have that ligament heal just as strong and tight as it used to be. So, you know, this is one of the common braces, which you've got to protect that ligament for about 6 weeks afterwards. And you can do it a number of different ways, including with a brace. It's not hard. I'd just like to say that while we're talking about sports injuries, because once you get looseness of the ligament, recurrent sprains, sometimes you need to take more steps to bring that back to normal.
Now, the ankle sprains are complicated because sometimes they're high ankle sprains and low ones, and they're a little tricky. So tell us a little bit about that.
Okay, now in football we're hearing much more about the high ankle sprain. Remember, a sprain is a tear of a ligament. Ligaments join bones together. These two bones in the ankle are joined by a lot of ligaments, and the ligaments at the bottom end right here, when that ligament tears, that's what they call a high ankle sprain. And I don't think you'll see that in tennis very much, so I don't want to talk about it too much. But by far the most common sprain is this, where I turn my ankle under and it swells up and you get a big bruise and things
on
like
the outside
that.
Of the ankle.
On the outside.
Rives, one of the things on that I'm seeing now with casual players who come out is the shoe a lot of the places are selling now are called cross trainer.
Yeah.
And so, but those shoes are all made for going straight ahead. Mm-hmm. If you're running, if you're jogging, if you're doing walking, or but on a tennis court, as like a basketball court, it's such a lateral movement game.
Right.
If the shoe sticks, the ankle's going to go. But a lot of people are sold on these shoes as being, oh, they're good for any sport, but really not for basketball or for tennis.
So but there's specific tennis shoes.
Yeah, it's called a court shoe. So you'd want to have, because you want to be able to have your shoe slide. Mm-hmm. But on a lot of the cross trainers, the way their sole is, the gripping, it's made for the foot to work like this and go straight ahead, but not to the side. And I think that's where I get nervous when someone comes out and they want to start playing. It's like, ooh, you know.
Right, exactly.
Then we have the shoulder.
It wouldn't be a tennis talk if we didn't talk about rotator cuff tendonitis. And you have the rotator cuff muscles. Basically, there are 4 of them, excuse me, that all attach laterally. So it's quite often you'll have pain that you'll feel here. And probably the most important place is this subacromial space, where if the muscles are functioning properly by the way they attach, it normally holds the head of the humerus down, and you maintain that space so that when you're doing overhead activities such as a serve, this doesn't ride up underneath and cause impingement, which is what typically leads to the pain when you do overhead reaching for things at home. So when you'll notice it, if not out on the court. Sometimes the adrenaline's going, you may not feel it while you're playing later in the day when you're reaching for something, or you can be sleeping at night, and by compressing down, if you're sleeping on your shoulder, you'll wake up with some shoulder pain.
Now, rotator cuff tears are common in tennis, and sometimes they're managed just medically, and sometimes they need surgery. When does it cross?
Yeah. What you ordinarily have at first is pinching, impingement, and the rotator cuff gets inflamed. That's tendonitis. And there's a bursa in there that helps lubricate it, and it gets inflamed, and that's bursitis. And ordinarily, the rotator cuff is not torn in the beginning unless you have some fall. And it's really worthwhile talking about the treatment for the tendonitis bursitis impingement. That's the most common, the thing that so many middle-aged people get. So
that they can't lift their arm, that it becomes so painful.
It's called a painful arc of motion. You know, it hurts the most right around here. If you can finally get it up here, it doesn't hurt as much. And it can really hurt. And what do you do about that?
Well, we always like to take a conservative approach at first, where you want to calm down inflammation, and that, excuse me, would be through anti-inflammatories, taking some rest from that type of stroke. During your tennis game, you might want to focus on other cardiovascular activities to stay in shape. Strengthening the rotator cuff muscles and some of the scapular stabilizers are going to help hold that head in place and keep it from riding up and causing impingement.
So would you do that
strengthen,
with, yeah, I'm sorry.
all those muscles back here, which would be your deltoid and your rhomboids. So you'd be working all your back muscles.
But how would you strengthen the rotator cuff muscles? What would you tell people to do?
Go to physical therapy.
Okay.
No, I mean, oftentimes we don't have a whole lot of time right there in that appointment to go over all the specific things. And I think proper technique while you're doing these activities, because you certainly could aggravate the problem if you're not doing your strengthening properly. So actually, I kind of joked about it, but quite often I do send people to physical therapy so they get some professional training.
But you must know there's certain muscle groups that you would tell your patients to strengthen.
Right. Yeah, physical therapists can be very helpful in muscle strengthening exercise. I like to give my patients simple exercises that they can do at home. And for instance, I have them get dumbbells of various sizes depending on their...
We're going to have to sum up, and because we're coming to the end, we're having such a great show. But to sum up about rotator cuff, we should see a physical therapist and strengthen those muscles. And Tennis for Life, start at age 4 at courtside. Call up Gordon Collins.
Love it.
Do the stretching. And thank you for joining us. And I hope you join us again for Health Talk.